Now, we're going to start with some of the negative consequences of CPAP. This does not mean they're true contraindications. These are things that you should expect to see when you put someone on CPAP, and that you should be very conscious and constantly evaluating when you have them on CPAP. So the first thing is this: it does absolutely increase the work of breathing. All righty. You have your diaphragm here, and this represents like all of the muscles that you use to breathe, right? And it's used to having gravity and sort of other pressures and all sorts of other effects that make it kind of work. So your diaphragm and your breathing muscles are kind of used to doing this. Well, now CPAP, bam, you just threw another whole weight on top of this thing. More pressure. Extra pressure now means extra work for these muscles to breathe against. So patients will likely tire out quicker on CPAP than they would without, unless it fixes the problem that you're putting them on CPAP for. Then their work of breathing will likely get better. But if you don't fix the bronchospasm quick enough, this work of breathing problem might become a big issue. And before you would ever be able to fix the bronchospasm or the pulmonary edema, their muscles will give out, or their energy levels will give out, and they'll go into respiratory failure. So again, this is just a risk that you need to know is occurring, and consistently weighing that benefit cost of applying the CPAP. As we talked about before, there's great things to use CPAP, but if this is starting to become a problem, then you need to potentially pull them off of the CPAP and take this extra weight kind of away, like that. All right, next, risk. No matter what, this pressurized air does absolutely increase the risk that we will have air accumulating in the stomach. And this is especially going to be important for our patients that become more lethargic or confused. Patients that are not going to be great at controlling their own airway are likely going to keep their airway closed off more, and their esophagus has nothing to block it. So the air is just going to go down into their belly. So you've got your patient here who's having trouble breathing. You go ahead and throw your CPAP mask on them. You're applying all this pressure, but they're not really controlling their airway very well. So all this pressurized air is now distending that belly. Oh no, because we know what follows is vomiting and aspiration. There's only one place for all this stuff to go. It's not going to burst like a cartoon, and it's not going to create this like flatulence thing that, you would again see in a cartoon. Instead, it's going to, bleh. This is going to be pressurized vomit in the mask, which is then going to pressurize that vomit down into their lungs. Aspiration. We got to immediately pull them off of this CPAP. You can't be pressurizing vomit down into the lungs. So this is a negative consequence. It is an absolute risk that this air will be filling the stomach, especially with patients that are not maintaining their airway very well. And the third risk, and again, there are more risks. I'm talking about the major ones today. But the third major risk is that there is going to be the potential for hypotension to occur. There's much higher increased potential for hypotension to occur when you put someone on CPAP. And that has to do with this: the increased intrathoracic pressure that occurs. So we've got an intrathoracic chamber here. This is in your chest. And there are pressures all inside of this chest. Now, with CPAP, for reasons that are well beyond what we need to talk about, but the pressures will build up and accumulate inside that chest cavity. This is going to be a problem because what starts to happen is twofold. You will start to get this external pressure on the vasculature leading to the heart, and that's going to narrow them or even potentially completely impede them. And away, the aorta can be impeded upon. So our vena cava, the blood return back to the heart, will be diminished. At the same time, the blood flow out of the heart will be diminished. Because if you remember, when we increase pressure, try to think of like a submarine going to the bottom of the ocean. there's all those external pressures on that submarine trying to crush it like a little can. So this is same thing is happening to your vasculature, which does not have the strength, does not have the wall strength to fight this. It's going to just collapse, and then you'll have no blood flow in or out of the heart. That's zero blood pressure, right? Additionally, do not ever, sort of underestimate the effect that it's also putting this external pressure on the heart itself. And so the heart doesn't get actually smaller physically. I'm trying to just show you that the heart has a much harder time expanding and contracting against this external pressure like this. It's a big problem. So it winds up just kind of getting this pressure, and it won't be able to kind of reflexive back. All of these things will lead to hypotension, a drop in the blood pressure, for reasons that you can obviously see here. So these three are big and really important for you to constantly evaluate: their mental status, their airway, their work of breathing, and their energy level, and their blood pressure. These are critical things that you need to be evaluating on a minute-by-minute basis with CPAP patients. Now, quickly, I want to explain there are hard contraindications for CPAP. You do not give CPAP under any circumstance when you have these situations in place. These are our sad stock photo lady. She's got the thumbs down. Do not be given these. She does not approve. So the first one is altered mental status and lethargy. We just talked about this. These will lead to airway problems. So you got that person that doesn't know how to follow commands, doesn't even understand what's going on. This is a spectrum, so do understand that hypoxia can cause people to be a bit confused. Use your best judgment. Is their confusion going to lead to an airway maintenance problem? Or if they're really tired, lethargic, they're nodding out on you, do not be giving CPAP to these patients. As we talked about, that is likely going to pressurize the stomach because they'll block off their airway. No CPAP. Hypotension, we talked about this in our earlier thing as well. Since it's going to lead to hypotension, we want to be cautious with people who are already hypotensive. And in this case, the hard stop for anyone is 90 systolic. Be really cautious, anything around that 100. And truthfully, 120, you need to start to really evaluate that risk reward benefit, or at least at 120, you should be very, very cognizant of their blood pressure evaluation while you have them on the CPAP. So if they're hypotensive, no CPAP, because it's going to lower the pressure anyway, kind of the way that we describe nitro. 3, pediatrics. So you got that kid with the balloon, under 12, no CPAP. We don't use the CPAP as EMS. This is something they do in the hospital. But in the field, in the EMS field, we don't really use CPAP for children. Their lungs are developing these extra pressures. You really need to know what you're doing. You need to know vent theory. You need to know a lot of really important physics theories to be able to appropriately administer and safely administer CPAP to pediatric patients. So in the field, EMS, we are not giving CPAP to patients under 12 years old. And then the last is trauma. And literally no trauma ever. Do not be pressurizing breathing, continuously pressurizing breathing during trauma. Now we might ventilate a patient during trauma. That's very likely, but that's very radically different from continuous airway pressures that we do with CPAP. So